Going to the vets is not something most dogs enjoy, is it, Harvey? I know. While some of the most common reasons for a vet visit can't be avoided, others can be reduced with some preventative care. Let's start with the annual checkup. Canine influenza and some other vaccination boosters are required annually, and as part of this visit, your vet will perform a full examination on your pooch. Remember, 1 year of your life is roughly equivalent, let's block your ears, to 7 dog years. I know. That's a long time when it comes to early disease detection and treatment, so even missing one annual visit could have a major impact on your dog's future health. Another common reason for a visit to the vets, particularly in spring and summer, is for the treatment of skin and ear issues. Humidity mixed with wet skin from dips in the ocean, as well as plenty of allergens in the air, can result in dermatitis and ear infections. Common symptoms include constant itching and licking at the skin and paws. It's important to get this diagnosed early so any potential bacterial or fungal infections can be treated. If left untreated, dermatitis can result in open, smelly and painful wounds, not to mention a very unhappy and constantly itchy pet. Determining the primary cause can take months of systematic trials and hard work, but it's definitely worth it in the end. Another common and rather unpleasant reason for vet visits are dogs' anal glands. These glands are 2 sacs located at about 4 and 8 o'clock at the entrance of your dog's bottom. They secrete a special signature marker on stools when they're passed. As dogs communicate mostly with their nose, this signature scent acts to inform other dogs about their personal information, which is why they sniff each other's bottoms when they meet. It's the equivalent of a little friendly handshake. Anal glands can become overfull and cause irritation to the dog, which may result in the dog scooting along the floor or licking around the area. Some of the time, this scooting effectively empties the glands. However, if it doesn't, and your dog is doing this frequently, for more than a day or so, you'll need to visit your vet so that the gland material can be expressed manually. This helps to avoid impaction and painful abscess formation. In severe cases, surgical removal of the glands can also be performed. Another top reason for a visit to the vets is vomiting and diarrhoea due to gastroenteritis. Dogs aren't the most discerning eaters, gobbling down old and rotten food they find at the park. Other times they may be fed overly fatty or rich leftovers from the dinner table. Mild cases may self-resolve, but if vomiting and diarrhoea continue, dehydration is a real risk. So if symptoms persist beyond a day, or if your dog is very young or elderly, take them straight to the vet for assessment. IV fluids and hospitalisation may well be required. Worse still, pancreatitis may be the underlying cause, and failure to treat this properly can lead to death. A quick in-house blood test can rule out this nasty disease at the first visit. HIF Pet Insurance can help with some of the costs associated with vet visits. Check out their website for full details. Isn't that right, Harvey? Yeah, I know.